Hello, and welcome to today's podcast, From Pain to Relief, How Liposuction Helps Reduce the Daily Struggle of Lipedema. I'm Dr. Sarah Mitchell, a specialist in lipedema treatment, and I'm excited to share some valuable information with you today.
And I'm Dr. Michael Roberts. As a surgeon who has performed hundreds of liposuction procedures for lipedema patients, I'm thrilled to join Dr. Mitchell in discussing this often misunderstood condition and how we can help those suffering from it.
Let's start with the basics. Lipedema is a chronic condition that affects almost exclusively women, characterized by an abnormal buildup of fat primarily in the legs and sometimes the arms. Unlike regular fat, lipedema fat is often painful to the touch and doesn't respond to traditional diet and exercise.
That's right, Sarah. And it's important to highlight that this isn't about weight or obesity. Lipedema is actually a medical condition that can affect women of all sizes. One of the most distinctive features is that the fat distribution is symmetrical, affecting both sides of the body equally, but it typically spares the hands and feet.
Exactly. Many women with lipedema have what we call a disproportionate body shape. They might have a relatively small upper body, but much larger legs or hips. This disproportion can cause significant physical and emotional distress.
And the daily struggles are real. Many of my patients report constant leg pain, heaviness, tenderness, and easy bruising. Simple activities like walking or climbing stairs can become extremely painful. As the condition progresses, mobility becomes increasingly limited, which further impacts quality of life.
I've had patients tell me they avoid social gatherings or activities they once enjoyed because of pain or embarrassment about their appearance. The psychological impact can be as debilitating as the physical symptoms. And unfortunately, many women suffer for years before receiving a proper diagnosis.
That's one of the most frustrating aspects. Lipedema is frequently misdiagnosed as simple obesity or lymphedema, which is a different condition affecting the lymphatic system. While lipedema can lead to lymphedema in later stages, they're distinct conditions requiring different approaches.
Michael, can you explain how liposuction differs when it's used specifically for lipedema versus cosmetic purposes?
Absolutely. This is a critical distinction. When we perform liposuction for lipedema, we're not doing it primarily for cosmetic reasons, but as a medical treatment to alleviate pain and improve mobility. We use specialized techniques like lymphatic sparing liposuction that preserve the lymphatic vessels while removing the abnormal fat cells.
And the results can be truly life-changing. While liposuction isn't a cure for lipedema, it can dramatically reduce symptoms and slow disease progression. Many patients report significant pain reduction, improved mobility, and better quality of life following the procedure.
Exactly. In my practice, I've seen patients who could barely walk before surgery return to activities they hadn't enjoyed in years, hiking, dancing, even just playing with their children or grandchildren without pain. The emotional transformation is often as profound as the physical one.
For those listening who suspect they might have lipedema or have already been diagnosed, what would you recommend as first steps?
First, get educated about the condition from reliable sources. Then, consult with healthcare providers who specialize in lipedema. Conservative treatments like compression garments, manual lymphatic drainage, and specialized exercise can help manage symptoms, especially in earlier stages.
That's great advice. And for those considering liposuction as a treatment option, I strongly recommend visiting liposuctionforlipedema.com. This comprehensive website offers detailed information about the condition and surgical options.
What I particularly value about this resource is their AI digital assistant. It provides private, personalized information and can answer specific questions about lipedema and treatment options. Many women find it helpful to get information this way before they're ready to speak with a medical professional.
Absolutely. The AI assistant is available 24/7 and can provide answers to those questions you might be hesitant to ask in person. It's an excellent first step for women who are just beginning to explore their options or aren't sure if their symptoms match lipedema.
And once you're ready to take the next step, the website also offers free consultations with specialized physicians. These doctors understand lipedema and can determine if you're a candidate for liposuction or other treatments.
I want to emphasize how important that specialized knowledge is. Not all healthcare providers are familiar with lipedema, and not all surgeons are experienced in the specific techniques needed for effective treatment. Finding the right medical team is crucial.
Couldn't agree more. And remember that while liposuction can significant relief, it's often part of a comprehensive treatment approach that may include compression therapy, nutrition guidance, and other supports before and after surgery.
Michael, what would you say to someone listening who has been suffering silently with what might be lipedema, perhaps feeling they just need to lose weight or exercise more?
I would say you're not alone, and it's not your fault. Lipedema is a medical condition, not a failure of willpower. If you've been struggling with painful, disproportionate fat that doesn't respond to diet and exercise, please seek help from knowledgeable providers.
And remember, early diagnosis and treatment can prevent progression to more severe stages. Visit liposuctionforlipedema.com, chat with their AI digital assistant about your symptoms, and schedule your free consultation with a specialized doctor. It could be the first step towards significant relief.
Knowledge is power when it comes to managing this condition. The more you understand about lipedema, the better equipped you'll be to advocate for appropriate care.
That's absolutely right. We're approaching the end of our time together, but I hope this discussion has been helpful for those of you struggling with lipedema or supporting someone who is.
I'd like to thank everyone for listening. Remember, lipedema may be a chronic condition, but with proper treatment, including specialized liposuction when appropriate, you can experience significant relief and reclaim activities you love.
Visit liposuctionforlipedema.com. Chat with their AI digital assistant for private advice and schedule your free consultation with a specialized doctor. From all of us, thank you for joining us today.